a student in Oxford Institute. My experience was very good. I get more benefit from pre-advanced and advanced stage, where there are 3 stages: basic, pre-advanced, and advanced stage. So I wish to show you my graduated report, which is about diabetic mellitus. I wish to show you it's clinically. Our topic today is about an important and common disease, especially in Iraq. We are seeing it a lot and consider as a fatal disease if we get it without treatment. Our topic is about diabetic mellitus, which means high in the blood glucose, called hyperglycemia, that occur either due to absolute insulin deficiency or relative deficiency, or due to insulin resistance. So blood glucose is regulated by pancreas, which is an organ located in the abdomen and considered as an endocrine gland because its hormone released directly into the blood. So when we eat a meal and food enters to the intestine, this leads to rise in the blood glucose. So now we need to regulate the blood glucose to the normal level by insulin, which is released from beta cell of pancreas, and help to move off the glucose from the blood to the cells to produce energy. But here there is an important point that should be noted, because the brain is dependent only on the glucose that enters to it. On the other hand, when we are fasting for a long time, this leads to decrease of blood glucose. So here glucagon is released from alpha cell of pancreas and lead to the regulated of blood glucose to the normal level. These processes occur only in the healthy people. All people have functioning pancreas. So in DM or diabetic mellitus, we have 4 types. Type 1 of DM, when there is absolute insulin deficiency, occur due to autoimmune disease that lead to destroy of pancreatic cells, and mostly occur in young people. And this type discovered suddenly when patients come with weight loss, polyuria, polydipsia, and polyphagia, and treated by insulin injection only. Type 2 of DM, when there is insulin but there is resistance to it, and occur mostly in adult people. Its causes is genetic, and there are many risk factors such as obesity, underactivity, and hypertension. This type is treated by pills such as metformin pills. And another type is gestational diabetes, which occur in pregnant women. And its causes is unknown, but thought that is returned to pregnancy hormones. And it's treated by insulin injection only and may be relieved after delivery. There is another type, which is a special type called occur due to drug-induced hyperglycemia, such as cortisone and phenytoin and else. So diagnosis of DM by history that is taken from patient as sign and symptoms. But in type 2, patient is asymptomatic but come to doctor with a complication. And by examination also and investigation, such as fasting blood glucose, that the patient should be fast for at least 8 hours, and random blood glucose and other related investigation. So because of diabetic food is common, because of patients with diabetes lose sensation in the peripheral nerve, and there is vascular problems. So there are many tips that should be follow it to take care of your food. First one is check your food for any crack, cuts, blisters, infection, unusual markers, and use a mirror to see the bottom of food if you cannot lift them up. And also check your legs or foot for any redness, swelling, or warmth. Wash your foot every day and dry it, and cut nails straight across. Change the socks every day, and avoid extreme heat or cold. So if you need advice or treatment, you should go to the food care specialist. Thank you.
معهد أوكسفورد القسم الإعلامي.